Hi, I'm Dr. Janice Morrow. Thanks for joining us for another episode of American Mood Swings, where we talk about the brain and all things related to mental health. Welcome. And mental health. We're really excited today to have Dr. Gideon Owusu. He is in healthcare policy analyst at Arizona State University, and he's in a graduate level studies program. So we're going to be talking about maternal mental health. We connected on LinkedIn, and many of you know, this is Mental Health Awareness Month, but they're focusing on maternal mental health and I this month. And I only became aware a couple of years ago that the United States has one of the highest maternal mortality rates in the world. And if you don't know what that means people, a lot of women are dying giving birth. And I was kind of shocked. I had no idea that this was happening here. You just for an industrialized country, and there's several reasons why, but Dr. Gideon has a strong background, so we're going to just kind of give him the floor. We're going to talk about why this is happening and solutions and things that can be done as far as policy. So and I think you're from Ghana. I don't know if you're from.
Yes, I'm from Ghana.
So I want to hear, yes, I want to hear a little bit about like how things are done in Ghana and if they're having the problems that the United States is. But so let's talk a little bit, Dr. Gideon, about what you do as a healthcare policy analyst.
All right. Thank you for the opportunity to talk about this. This is something very dear to my heart, maternal mental health. So, I'm happy I'm part of your program to help people understand. So, I am a medical doctor trained in Ghana, and for the most part of my profession, I have worked in rural communities, especially. And I've had a chance to work in areas that border maternal health and mental health. And in my practice, I noticed throughout the pregnancy and the childbirth process, one thing that clinicians like myself and others, we don't really pay much attention to is the mental state of the pregnant mother. And even after the baby is in, we have so much focused on baby is out, mother is fine, okay, go home. But then in my practice, I noticed that I was seeing a lot of women after birth coming with concerns that we never saw or we were not looking for when we were seeing them during their pregnancy. And this is something that has been dear to me. So I've actually done a lot of research to explore some of the lived experiences of these women and what they think we can do to help them. And even in ASU, this is something I'm seeking to explore further to understand the US landscape and also see some of the things I can learn from the US and bring to Ghana and some of the things from Ghana that is working for us that we can also bring in the US whilst I am here. So this is just a little bit about me.
Well, I was forever changed many years ago when Oprah Winfrey still had her show, her daily talk show. They were talking about maternal mental health, and a woman had killed herself or died by suicide. I'm sorry. And but her family was on the show because I, like a lot of people, if you haven't been that despondent or in that situation, it's hard to even relate to. And her family was on the show and said, that a lot of people think that this is something that women can just snap out of, take a pill. And they said that their daughter was the most vibrant, happy, outgoing. She wasn't a depressed, some people are just wired and depressed all the time. And she was a very vibrant, and there was definitely a change after childbirth. And she did end up passing away. So her family was there to promote that. So the United States has one of the world's highest maternal mortality rates for an industrial country. And Black women, it's even 3 to 4 times higher. The research is showing that we're having the highest number of pregnancy deaths in over 60 years. It's not getting better with all of the advances in medicine. So, and even women, we always think it's about poor women without access to health care. But there's been a lot of high profile women in the last few years, like even like Beyonce And Serena Williams. Serena Williams, I've heard her talk about how she almost died during childbirth. So she has access to the best healthcare out there. But I think she said that people weren't listening to her. So I want to talk about, and there was a very famous athlete, I just can't think of her name right now, they found her in her home and she had passed, but she had, access to some of the best healthcare. So some of the reasons that I've read, Dr. Gideon, are things like structural racism, implicit bias, access to care, training issues. If you could like expand on those. I mean, I just hear the word, but like what have you seen in Ghana and here that you think we need to work on?
Okay, so thank you. So one of the things, let me talk from my background as a clinician. The way we are trained to is a little different. Coming to the US, I noticed the US is very diverse, like different races of people here, if I would say. Unlike Ghana, where we are kind of the same, so the culture is a little similar. So being here, I've noticed that the training of clinicians, sometimes symptoms that people who are not within our race or ethnicity may present are things we may not understand or may not fix, like fit the textbook description. So when it happens like that, it's difficult for practitioners from different backgrounds to relate and even identify those symptoms on time. So that training gap is there. And it's kind of showing that okay, there is strength in diversity, but sometimes there are some weaknesses that this diversity can also bring, and that is one of it. And one of the things too is I wouldn't really say structural racism. There are different kinds of people here, and for some people, for a long time, they've been at the lower end when it comes to economic standing, when it comes to education, when it comes to access to some facilities. So people like that, especially in the South, where most Black women are, that is where most of these maternal deaths are reported. And you realize that they are in communities where health centers are far from them, or even they don't have a lot of practitioners in maternal health. And I think for some of these places, they call them desert counties when it comes to maternal health. So it is already difficult for them to access their health care. So when they are in any condition like that, looking at the wait times, the cost of transportation, even the time to even make the decision to go to the hospital, these all lead to factors that do not even allow them to get the healthcare on time. In my area, we call that the three delays. So these are things that happens because of their social standing. Then we also have the access to care in itself. Sometimes the facilities are not existing. They are not there. People are underinsured or uninsured because they don't have any job that will employ or give them insurance. So sometimes people tie the access to financial standing, but it is not really like that. Just like you mentioned, Serena Williams, this is somebody who has money. She could afford the care, but people could not resonate with the things she was telling her physicians. And so they kind of brushed off whatever suggestion or whatever thing she was feeling. So access to care goes beyond that. The kind of care the person expects, sometimes they do not get it, also because of their social standing and where they are coming from. One of the things too I'll talk about too is I've addressed the structural racism and the training gaps. Some facilities actually do not also have their professionals. With what is happening in the US, last night I was reading that in some states, the number of OBGYNs are reducing because they are not so sure of their future when it comes to their practice and the changing regulations. So
Oh,
these are all some of the things that are happening in the US. And
that's
unfortunately, pregnant women take the fall for it.
Wow, that's right. Well, what he's referring to, we're all aware of the change in policies with Roe v. Wade being reversed a couple years ago. So now there are certain states, probably I think there's 16 or 17 states with very restrictive abortion with access to abortion. So if a doctor, even when there's miscarriages and things of this nature, the state can be suspicious and go after the person who had the miscarriage or the doctor thinking that they had something to do with it. It's just very, yeah, it's a very difficult, but I didn't even realize that. You're right. A lot of them are like, I'm out. I don't want to deal with this anymore.
Yeah.
Can you talk about some of the things that I know or have after researching for this episode that lead to death, or things like hemorrhages, eclampsia? Can you talk about what those are for somebody who doesn't know? Because I've heard that black people or black women have a higher can have higher blood pressure, and that can lead to if that's undiagnosed. But can you just kind of touch on those, what those are, hemorrhaging and
Okay.
eclampsia?
Okay. So, hemorrhaging or hemorrhage, basically, we are talking about bleeding. So, in pregnant women or women giving birth, usually when they give birth, sometimes they may get some tears. We expect the womb also to go back to its normal shape, what we want it to contract. So once the uterus is able to contract, it's able to block the blood vessels. So it kind of helps stop the bleeding and all that. But for some women, it is not able to happen. So the uterus doesn't contract, so they continue bleeding. And some may also get tests. Even for those who may do cesarean section, they may have some underlying problems that will prevent their blood from clotting or stopping the way we want it to. So when it happens and the bleeding is in excess, that is when we are worried. And normally there are things we can do about it. We can either give them some medication to help stop the bleeding or even do a procedure so that the bleeding stops. We are more worried when the bleeding happens when they have already been discharged and they've gone home, especially for those who may deliver without any surgical procedure. So it's one thing we are worried, especially when women opt to give birth in their homes. We love the fact that their homes are comfort zones where they have their families and friends there, but we would rather prefer they make prior arrangements with a health facility so that in case there are emergencies like that, they are able to quickly go there for the needed help. When it comes to eclampsia, we are basically talking about hypertension during pregnancy or increased blood pressures during pregnancy. And hypertension in general is very common among people like myself of the Black race. So when it happens, it's not just increased blood pressures, it affects most of the organs in the body of the person. And for a pregnant woman who is already undergoing a lot of changes, this can affect a lot of things in their bodies, including their kidneys, even their brain. And some of them may even have their kidneys shutting down. And when it happens or causes complications in their brains, some of them may start falling or having seizures. Imagine being pregnant and having seizures.
I've never heard this. No, okay, okay.
So it's very bad. I have actually seen two cases like that in my practice. And when it happens like that, what you need to do, unfortunately, is to bring out the baby and put them in an incubator where accessible or where possible. Because once the placenta comes out, for most women, their BPs begin to stabilize and they get like very all right with continuous treatment and monitoring. But if you keep the pregnancy in, you would have to continuously monitor them, else we may lose mother and baby. So that is why it's important we take our prenatal assessment very serious. If you are able to continue your prenatal assessment, clinicians or health providers will be able to pick this on time, and we may not get all these complications that I have mentioned. So prenatal assessment is very important, and that is why access to prenatal care is also very important if you want to combat the risk of hypertension or preeclampsia in pregnancy.
Well, thank you for explaining those. So, and the difference. So, what's being done at the prenatal assessment? Pretty much, like what kind of things are you looking for? When if I just came in, it's my what are you going to be looking for?
So I have not had the chance to be involved in clinical practice in the US,
Oh,
but
okay.
in Ghana, you will do your routine blood checks. So we will check your blood pressures to know that they are within the normal limits for you as a pregnant person. We would also check your urine. There are once your high the blood pressures are increasing and it's affecting your kidneys or anything, there are some chemicals within your urine that will point to the fact that, oh, something is happening to this person. So we monitor your urine. We may monitor your weight and all that. Because once your kidneys also are having problems, even though pregnancy is going to increase your weight, we don't want any excess fluid accumulating in your body. So we want to monitor your weight to make sure that, okay, your weight is within the normal ranges for you as a pregnant person. So these are just some of the things we do. Blood tests too, to check how your kidneys are working, how other organs within your body are working. So these are all some of the things we do to make sure that in your prenatal assessment, you are in the best state of health to carry on with your journey.
Right. One of the things I learned preparing for this show was that so the US, when they are monitoring maternal deaths after birth, it stops at 6 weeks, and but that doesn't even cover the full that the gamut of all the women because that many women can have complications 6 months later or a year, which I wasn't aware of. I kind of thought, oh, if everything goes okay at the hospital, they're good. So what are some of the things that can happen when they go home that we need to be monitoring or still have access to care?
So, since we are talking about maternal mental health, one of the things I think for the most part we have ignored is the mental state of the new mother, especially for new mothers. This is a new thing. They have not done it before. And I have seen it because I have seen new mothers talk about how inadequate they feel and feeling that they don't have the support of people around them because everybody is busy like going about their daily work. So the mental state of new mothers and all mothers are something that I think for the most part we have not done very well with. And it's one thing that is actually causing some of the suicides in mothers, new mothers especially, as you mentioned at the beginning. Most of the suicides that occurs when you talk about maternal mental health has to do with the mental state of the woman after birth. So people feel those who commit suicide are weak, or it has nothing to do with that. It's your brain that shapes your reality. So once you have a mental health challenge or issue, that is your reality. Most people feel there is no way out because that is what their brain essentially is telling them. So they may not be able to analyze things the way we may be able to. We standing outside, not feeling the things they are feeling and not going through the things they are going through. They are not able to do that. So it means we need to be there for them, let them know we are around if they need us to help. If we need to also understand them, we don't have to judge them. They are new at this, they are learning, they will get better. So these are some of the things I feel if we are able to now look at, the US is doing amazing with that now. Recently, there has been a committee report on maternal mental health, and there have been some pillars. I think it's been presented to Senate, and we are looking forward to what happens. But I think the US has noticed this thing. It's being prioritized, and now steps are being taken to do something about it. So I think the US is doing very good, and I hope that when it becomes a huge thing, all of us in this space will be able to embrace it and see how best we can support it.
Well, I'm happy to see that they're doing. I know that there's a lot of discussion and advocacy for more maternal and paternal health leave. I think from what I've read, we have some of the shortest leave. I think it's just if you know anything about that, maybe you could talk about the time. I think it's just a matter of a few months, and women usually go back to work. Where other countries, they have more friendly, family friendly policies where the women or husband or dads get to stay home for 6 months to a year. And some individual companies, like especially the tech companies that have a lot of money, they're being more generous, and making up the difference. But what are your thoughts on that? And what's it like in Ghana compared to the United States when a woman gives birth? I'd love to hear the comparisons, the good and the pros and cons of each country, since that's where you're from and that's where you've worked.
Yeah. So I think the difference is how the society is structured. In Ghana, we do a lot of communal living. Childbirth is seen like it's adored. It's something that we love so much. So even a new mother, or once you give birth, you have relatives leaving their jobs to come stay with you for some time to take care of the child whilst you recuperate. So since I've been here, it's something I have not really seen in the US because US is fast paced, everybody is moving around. You can't leave your job for long hours or even long days. In Ghana, you are allowed to do that. The society supports that. And women also get paid leave to take care of their children and also recuperate. I am not very sure of how long, but I think it may be about 3 months. And depending on your company, you may get an extension. In the US, I have not seen it very much. I have just noted that sometimes you may get some days off, which may not even be paid.
Wow.
Yeah, so that is kind of the difference, but I think it's from how the society is structured. It's just from that. So yeah, but I don't know. It's difficult for me to understand that since I moved to the US because I grew up knowing that once you have a child, all your relatives are coming like that. But here it's different. I don't know. It's different.
It's really quite sad. Well, we have people are having smaller families, and then families are scattered. They're not like together like they used to be. They move around for jobs and such. But even if their families are close, it is different. The U.S. is different in a lot of things with respect to caregiving. Like we're one of, at least from my observations, most cultures around the world, like India, Mexico, probably Africa, but everybody takes care of the older people, right? When your parents get old and sick, not too many of them are putting them in homes and senior care facilities. And I mean, unless it's absolutely necessary, they need 24-hour care and you just can't. But the US, some US kids do that, but it's not like other cultures where it's just going to be expected. Of course, mom and dad are going to come live with us. It's like, well, no, that would, and it's really sad. And I have most of my friends from India, when they have a baby, to your point, even when they're here in the United States working, their parents come from India. Once there's a child, one set of parents comes for 6 months, then they go in the other set. So maybe, are you planning to stay in the United States? Or are you just here for a graduate program? Are you going to return to Ghana, or is your plan to stay in the United States?
So for now, I may be here for a while. I
Okay.
don't know what our future plans are because I'm here with my wife who also has her own plans. So, but I love what is happening in the US, especially with respect to healthcare. I've had a chance to attend a lot of conferences. As you mentioned, the US is investing so much in healthcare, but the expected outcomes are not being seen, and stakeholders are trying to do something about it. And I think for that, I am in the US at the time where a lot of wonderful things are going to happen, and I look forward to being a part of it. But the experiences I have had from Ghana, I want to see how this pans out. And so that once I am ready to go back to Ghana, I can also learn a thing or two and see how I can improve wherever I decide to work when I go back to Ghana.
Go back. You kind of touched on this earlier, but I have the research shows that more and more women, especially women of color, feel that since there's discrimination or they feel it in the hospitals, there's a trend towards doing home births. and you mentioned that there's risk involved. And I remember years ago at the gym, there was a nurse that I swam with, a delivery nurse, and she said, "Don't ever do any of those kooky things, Janice, and do like a water birth at home and things because of these." Because of the potential complications and not being near a hospital. But then
Yeah.
there's, what's your thoughts on, like, or even at the hospital or in the preparation while women are pregnant now, like doulas and midwives, because in other cultures, like maybe you could explain what a doula is, but a lot of cultures, this is very common to have a woman involved in the delivery as well as your gynecologist, or instead, if they're going to do a home birth. What are your thoughts, but on that?
All right. So I think doulas are very essential parts of the healthcare system, especially in the US where there is diversity, like lots of people from different cultures. The doulas are able to provide them with the psychological help and company that they may need during that time. And the doula essentially becomes a part of this person's family and journey so that they get all the assistance they need. Not clinical assistance, but the psychological and the social. The healthcare provider or clinician is still very essential in this journey. Doulas do not take that role. In Ghana, for doulas are not really a thing in Ghana because essentially all family members are there to help you. So we don't have that. But we have midwives who are part of the healthcare system, who are part of the providers. So normally for cases that has been identified as no risk or low risk by the obs and gynae specialist, the midwives are very essential. They may help in the normal delivery, needing no surgical procedure. So that is the role of the midwives in the Ghanaian system. Here in the US, I don't know how much midwives are allowed to do, but I know obs and gynaes are also there even in the low risk pregnancies. The physicians take the lead in everything that happens. And I think for the most part, it's very good. When there are problems, it can be caught on time. Unlike in Ghana, where in some rural areas where we don't have physicians, midwives do everything. When there are complications, there is that much they can do. And we sometimes end up losing these women, which is not very common in the US. So I think the US is doing very good in that. And maybe as we get more physicians in Ghana in the future, it's something that we can do, make sure that we have physicians in every hospital in the rural areas, whilst the midwives are also being essentially supervised to carry out their assigned duties. So but I think they're essential, but they need to be regulated. There should be a physician. They should work together hand in hand. Where the midwife can do such a task, they should be allowed to do it. And the dualists especially should be embraced, especially the US is diverse, so that everybody feels listened to, feels that their needs have been attended to. So I don't know, these are my little views on that
No,
subject.
no. Well, I want a lot of people. I only heard the word doula maybe 10 years ago when one of my patients was, she was all about home births and talked about her doula a lot. And she was the first woman I knew here in the United States that used one. One of the things that came up when I was researching for this is that, one of the differences is that for OBGYNs and the doctor, there's very like structured training and requirements and board requirements. They have to like have delivered at least 200 vaginal births every year. They're recertified, things like that. Whereas the doulas and midwives, that it can just vary it with training. So that those were some of the issues that people are concerned about. Do you think it might help, like for Black women, to have a Black doctor, or not necessarily? Because, like, I've never cared as a woman for my
Yeah.
OBGYN. I never cared if it was a man or a woman. Well, actually, kind of men were more gentle, I thought. But just on a side note, but I never really cared. It's never crossed my mind, but I haven't had any issues. So, do you think that that would be a factor or not really?
I really think it's not important that people see clinicians of their race now. I think what we need is cultural competency. No matter what, we need to learn how to live together in all aspects of life. And it's one thing that I think is coming up now. People are noticing, oh, we need to help people be culturally competent wherever they are working. So I am thinking the health facilities should take a pioneering role in this. If they employ someone, they should look at, okay, this person doesn't belong to this culture that he's going to work with, or the majority of people that he's going to work with. So are there in-house trainings that you can give to this person
Excuse
so
me.
that this person can understand the culture of the people?
Oh, I like that.
So once we are able to do that, it helps. It's going to help. It's going to change a lot of things. For instance, as a Black person, there are some beliefs that are inherent to us. I grew up very superstitious, believing in a lot of things. But being in the US, I've realized that most people don't hold the same ideas.
Could you give
So,
us could you give us some examples of those?
so for instance, almost every African I know back home believes that there is a God. We believe that sometimes when you do negative things, bad things would happen to you. But being here, I've realized that it's not like that. People believe in freedom. People believe that it is what I am doing. If the consequence is going to come, it's going to come now. They don't believe in any spiritual being like giving, punishing them or something. So even the way we approach mental health care in my home country for most of people is different. For some people, before they would come to the hospital, they've gone to all the faith-based healing centers. They've done everything they can do before they now come to the hospital. In the US, it may not be the same. So if you have someone who believes in all these things coming, if you are not careful, you may even misdiagnose them with what is very commonly done here, schizophrenia, for people of Black ethnicity. Because we have those inherent beliefs, it may be misinterpreted as paranoia,
Oh,
and it may go with a diagnosis that doesn't really fit the actuality of the person or the reality of the person. So it is only these trainings that can help bridge some of these cultural nuances and differences. And yeah, essentially that to better the healthcare system. I do not advocate for Black physicians or clinicians seeing, yeah, I don't. I think it's going to just be divisive.
okay.
Yeah.
That very interesting about the mental health. I was going to ask you about that because there's still, even now, I mean, we're talking about mental health a lot more in the United States for sure, but there's still a lot of people that feel there's a stigma with regards to taking medicine. Like they don't want people to know they're taking it. They don't want it in their patient charts, things like that. But now that we're talking, I mean, there a lot of these psychotropic drugs that help people have side effects. So for a pregnant woman or someone who's just given birth, and if they want to breastfeed, they might not be able. So what are your thoughts, and culturally, like how are the people in Ghana with respect to medicine, or is it more? Yeah, so let's talk about like the receptiveness to medicines and things like that, because there are people that are like, I don't want to take a pill, for no reasons, no ifs, ands, or buts, and other people are more receptive, and sometimes you just have to work with them. What are your approaches and things? What's the difference in cultures?
Okay. So I think for mental health in general, one of the challenges we have is compliance to medications by patients. For most people we attend to, you need to really work with them to get them to take their medication. So I think that cuts across when it comes to mental health. So that is why it's essential. It's their brain. They don't even see why they need to take it. Unlike somebody who has hypertension and knows that this is killing me, I need to get better. They don't see things that way. So it's even difficult getting them to understand that they are having a challenge and you are doing the best to help them. So that is the main hurdle. So once you are able to get them to understand that there is a diagnosis and we are helping you, this is a plan that we are all going through. Once they're able to understand that, usually they will be taking their medications. but you still need to follow up with them, encourage them, motivate them to stay with the plan to get their medications. So in Ghana, for the most part, once you're able to go over this obstacle, compliance is very great because you already have family members there to support them. As I mentioned, we are communal. Before they came, they had already done all the faith-based healing stuff. So now they are convinced that the doctor can do something to help. So they get all the support. And for most people, they get better and they continue with their lives. But I think for the US, it's as I mentioned, it's different. It's fast-paced. You don't have family around you. So you go to the outpatient, you get your medications, you come home. Already, you are struggling to understand that you really have this diagnosis. So probability that such a person will not take the medicine is high compared to someone who has all family members around, giving them the motivation. So that is kind of the little difference. But once you have someone with you helping you, it gets better. We also so much are not happy with institutionalization of people with mental health conditions. It's not good. We don't want to do it, but sometimes we are forced to because it's important these people are still within their communities, their societies, once they are undergoing treatment, so that they can continue reintegrating into the community. Once you institutionalize them, that's where sometimes the stigma also comes from. People tag them that, oh, you've been in this place, oh, you've done this, because people still don't understand that anybody can suffer from mental illness. So that is one of the things we look at. So in most of the treatment protocols we use, we have what we call the biopsychosocial. So the biological, we are talking about the medications and all that, the psychological, the therapies and all that, and the social, the communities, the resources available to you within the communities. So that is how we approach treatment for mental health conditions. And yeah, once all these parts come together, people are likely to also take their medications.
All right. What are your thoughts? I mean, it wasn't on the list of questions, but now that we're chatting, about women, when they're having miscarriages or there's a problem with the baby. One of the things I didn't realize till I started doing this show, and I guess it was a naivete, is that when people have a miscarriage or losing their child, like how long, I guess maybe there was a part of me, I just didn't realize how long people could grieve over that when they've had, or multiple miscarriages, and how that affects them and how that pain. Well, my brother and his wife in Hawaii, they were expecting a second child and then she had had a miscarriage. But I mean, it was like years later, 5, 6 years later, and she wanted to talk about it. And my brother was like, I don't want to talk about it anymore. Like it was too painful, but she constantly brought it up. And I didn't know what to say. Like, have you seen a lot of women like lose their children or miscarriages and such? And then also when they don't lose them before, but now they are born with a problem, and culturally, like, it's hard for people. Did I do something wrong? And depending on your spiritual beliefs, is this punishment or it's genetics? What are your thoughts on that?
Yeah. So I think it's amazing you bring this up. One of the research I did, I am yet to publish, but I'll just give this to your audience free of for them to have firsthand. One of the women I interviewed in Ghana during one of my research actually gave birth to a child who was considered an albino. And once the child was coming in the process, she said the attendant clinician started calling her and saying, "See what you have brought. Your child is an albino." And they started calling her albino mommy, even in the hospital. And I it was never part of my training to do that to people. So in the interview, I was so not happy. And that was when I saw that, oh, even we healthcare providers, sometimes the things we say or do takes a huge toll on these people. So for somebody losing a child, If it is not assessed that this person may be going through a mental health problem, they bury it inside because they never got the therapy, they were never healed. So it's just a wound. Instead of being dressed, you just wear clothes to cover it. Once the clothes are off, definitely everybody will see there is a wound. And that is what happens to these people because we don't identify it, we don't prioritize it for the most part in the past. So it is easier for this to come up when there are conversations about children, when there are conversations about pregnancy, or in their subsequent attempts to get pregnant, it doesn't happen. They would always think about that one event or episode in the past. And mothers, I think, are the same everywhere. Their emotions are attached to what they carry, the gift that they carry during pregnancy. And you may call it how you want, but they have a lot of wishes and aspirations for what they carry, the gift they carry. So even before the baby comes, some mothers have already gone into the future to see what the child would be. So they have planned everything. So if it doesn't happen, it is dreams crashing, hopes crashing, and this takes a huge toll on them. And that is why it's important we understand that it is not just something they are carrying, but all the emotions attached, all the experiences that's like fall through when the end goal is not achieved. So once we're able to understand this, it helps us better appreciate that women need a lot of support during pregnancy and even after birth.
How about men, with pregnancy? There's more discussion now than I've ever heard, like, because a lot of people are struggling with infertility and in vitro and all this treatment is very expensive. And if you can't afford it, it's just I see some men's groups on LinkedIn, but have you worked with, I mean, it doesn't seem like men would feel as comfortable to talk about this, or they must be just as sad when they lose a child, or how do we get support men when there's a problem or a birth defect or a loss? Have you dealt with this at all?
Yeah, I have. Actually, it takes a huge toll on men too, especially as one, most often they have to comfort their grieving wife and also live with the fact that they just lost a child they never had and plus societal demands. So it takes a huge toll on men. It's one thing that we have also not addressed. For the purpose of my path and career, I have not looked into men, but I have dealt with some. But I felt on the larger scale that of women have been ignored. Men are often able to talk to their colleagues about some of these things, and their colleagues may kind of cheer them up. But for women, when it comes to pregnancy and childbirth, usually they may not really open up to people, except their clinicians or people they trust can be of help. So that is one of the challenge. And women, they carry that gift. They carry the gift of a child. So once it happens, physically, it takes a toll on them and emotionally and mentally. Unlike the fathers, where it may just be the mentally and the emotionally. So that is why I think for the most part, attention is going to women. But definitely, we need to also look at the men to understand what they go through and to see how we can better also support and assist them.
Well, since you're in policy and that's your area of research, what are some of the big, I don't think we can change the family situation or the idea, like you were saying, contrasting Ghana where the whole family, what are some policy changes that you would like to see happen here in the United States or that we need to implement to help all these mothers with their mental health? What
One thing that is working well for us in Ghana that I hope when the bill is passed and everything works out, will be looked at is community health workers. In Ghana, we have that a lot. We have community health workers who are from the communities where these women are. So what we do is that they go visit with them, go to their communities, do all the assessments, even after childbirth, do all the assessments in the communities so that these women can go about their normal duties. They answer questions these women may have and brings back report to the facilities where these community health workers are assigned to. So once this is done, anytime the woman comes to the hospital or when it is deemed urgent, we are able to make follow-up visits with these women to see how best we will support them. I know the US is big, huge, but I think if we are able to also look at this, it will go a long way to help address some of these challenges with the mental health of women, especially.
Well, now that you've brought that up, I don't recall any friend ever telling me once they had a baby that anybody ever came to their house after they gave birth to check on them. Or, I mean, you go to your doctor for your for your checkup, but I've never heard of anybody going to the house to see how they are, like an outreach. And like you had mentioned, and this is becoming a hot topic here in the United States because we do spend the most in the world per person on healthcare, and the outcomes are catastrophic. Everything from like super high maternal mortality to shortest lifespans in the world. Some of them come for an industrial, most chronic disease, most obesity. So the outcomes, I'm very happy with the changes in our leadership in healthcare, and I hope that they redirect some of this money. But this kind of a thing for prevention or home, we do this when people are elderly here, like once they are on Medicare, and if it's called activities of daily living. If they need some help at the house, well, actually, you have to hire your own, but if you're really poor, you can get some, if you underneath a certain income, you can get help at the house with your daily activities of daily living. But that would be nice to see for pregnant women. I wanted to just bring up the sleep thing because so many people don't realize how important. I mean, they've done a lot of sleep and dream research studies, and when you are denied that REM state, which is your dream state, there's 4 stages of sleep, people can present like they have schizophrenia and psychotic symptoms. So for women being interrupted all night long, not getting a good night's sleep, or, even I know if women have resources now, a thing that's here, I don't know about in your state, but in California, if they have the resources, people are hiring sleep nurses now to watch the baby at night so they can. But that's a luxury most women can't afford. And my mom said, "Wow, this, a sleep nurse, right? How what a dream that would be." So, is there anything else that you'd like to bring up that you've seen since we're on the topic of mental health? I know we've covered kind of a lot that change,
Yeah.
well, things that you can offer. Any parting words of wisdom or things you'd like to share that I haven't
So,
asked?
yeah. So one thing I just want to share is that thank you for the work that you're doing
Oh,
with the American mood swings and bringing awareness to some of these issues. And it's amazing how much is being said about mental health. And I am so much happy that now we are talking about the mental health of women and even fathers. And I think the US is at a stage where the US is going to make a lot of changes in with respect to mental health, with addiction, and all aspects of mental health. And I think it is time that the US come together as one and address this issue. Everywhere we look up to the US in what happens. And one thing too that is happening in the US, there is so much research that has been done on these topics. And it takes a long time for the research findings to be implemented in policy and even practice, which is about 17 years for
wow.
most of the research that is done. So it is getting to the point where we need to find a way to fast track how research findings are implemented in policy and practice. If we are able to do that, the US being like one of the leading research countries in the world, I think a lot will be achieved in this space of mental health. And um, I think not to sound political, the US should understand that, or people in the US should understand that once they are able to understand the causes of mental illness and come together, a lot can be achieved. We cannot tackle mental health or maternal mental health on divided lines. We need to come together. It can happen to anyone. You don't have to do something to be affected by a condition classified as mental illness. It can happen to anyone. I have seen the strongest, I have seen the weakest, I have seen the influential, I have seen the least in society. all suffer from mental health illnesses. So this is something I just want to bring around. Let us all look at it. Let us avoid the stigma. Let us see how we can support people struggling with mental illnesses. And let us also see how we can support causes that are advocating for mental health. And once we're able to do this, I think we get a society that is promoting healthy living for everyone, and especially for mothers.
Right. Well, thank you very much for taking the time to join me today and be a guest. And it's really fun. I love that you brought your son on just for a couple moments at the beginning, but also to hear world thoughts. We are humanity, childbirth and mental health are universal things, and they affect every culture. And I like hearing how things are done in other countries, good things and bad things. We definitely there's room for improvement here. Clearly, we have too many women losing their lives. So I hope you'll keep in touch. But I so
Thank you.
appreciate you joining me today, Dr. Gideon.
Thank you.
I
Thank you,
learned,
Janice. I appreciate this.
I learned a lot. Okay, have a great Memorial weekend.
Thank you, and you too.
Okay, bye-bye.
Bye.
Thanks, everybody, for joining us for another episode of American Mood Swings, where we talk about the brain and all things mental health. Hope to see you next week, and please share with your friends.